COVID is going to amplify whatever is. So if countries are particularly punitive, they are likely to clamp down even more and use this as an excuse. And if countries actually are looking at some changes and are open to some changes, it's likely that those changes will move faster. Because, if you look at Mexico, where, for example, military was brought out on the streets by President Calderon to deal with drugs, well, no one is going to pull them back now because of COVID. Same thing in the Philippines.
About the problem of COVID, kung gusto ninyo barilan, di sige. Shoot them dead.
Well, this has been like crazy right now. For example, what is going on here in Colombia, in some places, you would go out and you would see some red flags in houses, and it means that people are like not eating there. They don't have food. When you translate that into actions for drug users, you won't fight human rights, you won't fight solidarity, you won't find compassion there. It's so related to morals. These people who need drugs, why do we have to take care of them? Problems with the drug policy are problems related with social justice. When you do not have a place to live, but you take drugs in the streets, well, you have problems with COVID. The streets are empty. The police are the one taking over. Since we are in the middle of this health crisis, they have to go to ER, to the emergency rooms, in order to get the methadone, with all the complications regarding COVID and having the possibility to have COVID because they have to go to the ER. When everybody doesn't have an access to healthcare, you're also in danger. This COVID crisis, what is showing us, other than the problem of social justice, is the problem of how do we control our societies, no? And what is the real power that police and armed forces have?
If there is one thing that COVID has shown us, is how senseless, cruel prisons are. People clearly cannot social distance. In the United States, the first man to die of COVID was in prison for non-violent drug offense, an African American. The first woman to die of COVID in U.S. prison, a Native American young woman who actually gave birth, I think, a couple of days before dying of COVID on the ventilator. Therefore, non-violent drug offense. Yeah, it's just awful. It's awful, it's unjust, it's cruel, and it has pretty significant race dimension. Well, I think in actually public health space, there's some innovation, like letting people take their methadone home.
Well, the big fear with the approaching pandemic was that homeless people, as you can imagine, have the worst health statistics in the Western world. Al Story says that where the health statistics are sort of going down a slope when you're going into areas of deprivation, when you hit homelessness, they go over a cliff. They've very, very high mortality rates, high rates of addiction, high rates of all the diseases that we all face commonly. But we actually very rapidly hit the ground running. We had a number of organisations working in the health and addiction services in Dublin, and they all came together as one group. The problem was that these people needed the methadone delivered, they needed support while in isolation, and they needed to manage harm reduction even while in isolation. So we got the organisations and a Liffey Drug Project and Chrysalis, who set up a fantastic service of, one, transporting people to accommodations, two, is transporting their medication, including their methadone. And it actually was a very successful outcome because we only had less than 40 cases of COVID in the homeless population, which is around 2,500 people. And we had one death That was a 97-year-old man who contracted COVID in hospital, not in a hospital. The crisis allows people to take rapid action and to sometimes cut through bureaucratic red tape. There is an element in medicine of do no harm. So that means that we should be very careful about starting people on methadone. The problem, I think, is that sometimes that do no harm, the fear of doing harm, sort of suppresses the actual ability to do good. So I do think interventions of rapid access to methadone, which we all know anyway, makes sense. So, we shouldn't have to get evidence to show that. The other thing is that access to accommodation improves health. Again, we don't need evidence to show that. We all know that exists. Probably the area where is less explored is the area of benzo maintenance, which we are continuing for our service, but we don't have an evidence base to recommend that to other services. But we found reportedly that people significantly improved and were less likely to use drugs.
What has worked with drug users is when the community takes care of them, and when we create connections between them, and when we we don't take them out of the society.
And so I think in the public health space, I think we're having some wins again that I hope stick, and I hope they stick forever, and that will be a new way of practice.